So I'm Dr. Suzy Harris. I am thrilled to be here, truly. I mean, after listening to Nora. No, it's good. I'm like, I need that book in every room in my office. Seriously. Yeah, so thank you so much. An incredible amount of information, and all of the things that she was saying, for me, just gives me this like grounded sense of certainty, which makes me feel more powerful in what I do, because we talk about this every day in our practice, all about the different gut healing issues and how it is absolutely true that nutritional deficiencies and imbalances can be the underlying causes of these seemingly untouchable diseases. So you can, I see people very fear-based a little bit, like it can't, that sounds really neat, Dr. Harris, but this is actually a disease, so you may not be able to help me with that. But truly, anything can cause anything, and there are many, many, many ways to go after trying to bring the body to center so the innate intelligence can come forward and heal things. So, I'm so excited to be here. Let me just make sure I do this right. I was nervous that I won't be able to see that far. I'm kind of needing the bifocal situation soon. So if I step out here, it's because I can't see. Before I do anything, I want to thank, and I am going to have to take a look, Shelburne Farms for putting this on, David Hollenbach and the Latner Foundation, sponsoring projects which advance solutions and inspire others to contribute. That is so huge. I want to make sure I don't forget, if you are interested after things break out and you're milling around the tables, Cedarwood Natural Health Center has a table over there. If you're interested in participating in a round table after this event, because what's more important when you learn this kind of information and you get some aha moments, how powerful to bring back into your communities in some form. Maybe it's a book club, maybe it's your babysitter, maybe it's, you're a part of a food directorship of a children's center. These are huge, 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 life-changing pieces of information. I would encourage you to be involved in sharing what you learn with people who could use it. So, Tree McCarney, Director of the Community Program, Shelburne Farms, Educating for a Sustainable Future. I wouldn't be here talking if I hadn't met her and convinced her that I had cool things to say. Carol McQuillan from Common Roots, what an amazing organization, connecting farmers, educators, youth, and community members to build sustainable futures. So, the theme is sustainable, sustainable, sustainable. Sustainable you, sustainable farms, sustainable food. And my Cherokee background makes me care about the 7 generations that are coming behind us. So it's always important to figure out what you're doing for yourself. But I like to think that we're looking forward, walking in the ways that maybe ancestors dreamed of us, and back in the ways that we could leave things better. So let's see. That's us, Cedarwood Natural Health Center, integrative natural health practice. That's what we do. We do applied kinesiology chiropractic. It's a holistic form of chiropractic care. I'm not going to get too deeply into that. We have a table if you want to talk to us about that. But it is a very well-rounded, holistic, moderately superior form of chiropractic care. Okay, just kidding, sort of. So therapeutic massage, we bring that into our office. We do exercise and lifestyle consultation. Clinically individualized nutritional healing programs. That's what I'm going to be talking with you about. It's called nutrition response testing. It's a technique that can be used to uncover issues that might be happening specific to you, your body, because all this information is incredibly helpful and impactful. And then you kind of want to know, well, so how do I get started? What does that mean for me? And do I have that or do I not have that? So this can help with that. We are also a teaching space and a community resource center. If you happen to be a practitioner or a wellness provider yourself, I encourage you to come talk to us at our table. We have a classroom. My intention for it is to be exposing our practice base to all the resources that are available in our community. It takes a village, people. So, I don't claim that we have the corner on everything people need to be well. So it's important for me to know who my fellow practitioners are, medical, non-medical, energy body workers, Reiki, acupuncture, emotional health handling. You cannot be well if you're not hitting all angles. So if you want to come talk to our practice about what you do, I invite you to say something to us. Here's the mission. Oh gosh, wordy, wordy me. To create a community of fully educated people who choose to take full responsibility for their health and agree to participate in working together to establish a true healthcare system that actually works and frees us and our future generations from the harmful and destructive practices, the current medico-pharmaceutical model. Now, I am not anti-medical. I am in awe of the guts it takes to be a medical doctor and step into that genre of healthcare where people need you in a crisis state, And then there are all these health issues going on that people are plagued with that can be quite debilitating, that I would venture to say are actually functional health problems. They're not disease, and they may not need drugs and surgery. Most of them don't. Those are the rare cases. So anything from GERD and gallbladder trouble, bowel trouble, migraines, infertility, anxiety, depression. You heard from Nora how incredibly powerful when you uncover the imbalances that may be happening for you, that you can touch those things, you can change those things. Medical is always there if we need that. It's a nice back pocket backup for these health issues that may actually need the medical intervention as well. Should we read that together? Not today. Okay. So a few facts. Nutrition science began about 200 years ago. Surgery began in 1650. So it's no wonder that the information that's out there might be just a little tipped in one direction. And as a nutritionist and natural health physician, it is a challenge to meet people in a way that gains their trust, because the information that we've been inundated with for a very long time does not necessarily understand some of what we talk about. So we can look a little crazy, but we're very effective. So the United States constitutes approximately 5% of the world population. Americans consume 80% of the world's supply of painkillers. What is up with that? Do we have like a painkiller insufficiency or deficiency? Okay, so the U.S. consumes more than 110 tons of pure addictive opiates every year as the country's prescription drug abuse epidemic explodes. Again, I am not anti-drug. If I have someone as a chiropractor who is, when I'm being their chiropractor, if they're in incredible pain and they cannot rest and sleep, they're not going to heal. So of course a pain med makes sense, but I hope it's temporary, and we're working on the underpinnings to get them out of that situation so they can move away from that. And that goes for any med, really. Well, I shouldn't be so lofty, but lots of meds. In the United States today, more than 6 million children are taking mind-altering psychiatric drugs for the learning and behavioral disorder ADHD. Wow. That's incredible to me. That's what got me into the nutrition side of my practice. I was really actually in Boston trying to get my license renewed, by keeping my credits current. And there was a guy there, Dr. Freddie Ulan, came in with these placards that were pictures of children. This is so-and-so, he's 8, he's dead. This is so-and-so, she's 12, she's dead. These meds do cause heart attacks in children. They cause all kinds of health issues that are not small. We can sort of get a little desensitized maybe to it because it's so common. And look, that's kind of what happened with antibiotics a little bit. It's so common, you think, we do that. So that is an inspiring thing for me to keep working, to reach the kids. I care about all of you in here too, but especially reaching into the children. Oops, wrong way. 2 million children take antidepressants and antipsychotic drugs. They've never been tested on children. And they actually increase the tendency for suicide. So I find that if I'm upset about a statistic, then I must not be in action enough about it. I'm not an us and them or a, oh, those darn people and blah, blah, negative stuff. It's more like if something bothers me, I'd like to be in action about it. So I'm going to keep nudging you guys. If you hear something that disturbs you, find a way to be in action about it. So eating a Western diet, lots of processed foods, poor quality fats and sugars, lots of refined grains, leads to a high rate of Western diseases, obesity, type 2, diabetes, cardiovascular disease, and cancer. Is there anybody who doubts that diet can be a part of the cause of these diseases, cancer and that sort of thing? Absolutely stacked audience. Perfect. Okay, so populations eating a wide range of traditional diets that include healthy fat, carbohydrates, and some sugar do not suffer from the chronic disease states. People who shift away from the Western diet see dramatic improvements in their health. It really can change. Everybody's bodies are so different that you can't really say to what degree must you change and in how many days will you notice it's better. I feel like that's part of my job in my practice is loving people up, holding space for them to be frustrated, letting them know they don't have to be perfect, and if you just find a way to stay with it, you are going to see change. This body only knows how to heal. If you take the boot off of it, get the barriers out of its way, and feed it nutrient-dense foods, it's rare that it won't respond. So a typical American population that departs from the Western diet could reduce its chance of getting coronary artery disease by 80%, colon cancer by 70%, and type 2 diabetes by 90%. I took this from Michael Pollan's Food Rules book. Have you ever seen that little book that he's the Omnivore's Dilemma? He's got a cool little food rules book that says stuff like, don't get your food where you get your gas, and things like that. Or else you're going to have, you know what I'm saying? So you can get those changes unless food and lifestyle changes alone are not enough. And I believe that that's where the nutrition response testing comes in as a tool. It replaces nothing, not even your medical doctor and your annual physicals and blood labs, your current team that you use, acupuncture, whatever you have figured out that works well for you. This tool doesn't replace any of that, but it is a very powerful way to get underneath some things that could be blocking you. I'm so lucky to work in this state. People here, my colleagues that are from other parts of the United States, struggle a little more than I do here because everyone here, we have such beautiful access to amazing farms and educators that are talking about food is real and you got to eat it to be well. So I don't walk in having to educate that ramen and Sunny Delight is not food. So a lot of people come in and they're already eating better, they're already exercising, and they're frustrated that it's not changing anything, so they're about to start believing it's a disease and they need to either drug it or have a surgery to deal with it. There could be something in the way of your body's ability to respond to those approaches that are really smart. So you could take any health issue and put it in this top balloon there. It could be cardiac disease, diabetes. It could be anxiety, depression, infertility. We've seen MS and Crohn's and Graves' disease, autoimmune things. Will MS go away? I've had 2 cases that they did reverse the diagnosis because it wasn't actually MS, it was MS-like. And there were heavy metals hung up in the spine that when we detoxed it, it went away. That is a really awesome, lofty day. It's not usually that easy. I do have a gentleman who does deal with MS. He is not MS-free, but he's not having to keep going down the rabbit hole of stronger, more scary, untested drugs, and he's back in his garden, he's back being an artist, he goes for walks with his dog. So you can bring the severity of a medical condition down so that the medical interventions can be less intrusive. So nutritional deficiency, the thought of this approach is that any health issue that would be up in that top bubble, nutritional deficiency is part, if not majorly, the cause. So either a person's not eating enough nutritionally dense foods, which happens, or they are, but they're not absorbing it. So if you're not getting nutrients across the gut, your cells need all of those nutrients that Nora talked about. I'm sure you got all that down. You're going to have to buy her book. That's a lot of information. So, but you have to get those nutrients across the gut in order to get your cells to benefit from them. Every cell makes up a tissue. It's either muscle or bone or brain or nerve tissue. Those tissues make up organs, your heart, your bowel, and the organs make up systems, your cardiovascular system, your nervous system, your digestive system, hormonal system. So it can seem sometimes a little lofty to think that a nutritional issue could be causing someone's serious system disease. And even autoimmune issues, they can be touched, they can be reversed. And again, if they're not fully reversed, you can have a little less need of intrusive medical interventions. So that's the idea. So nutrition response testing. We have a table here today if you want to stop by later and experience it. Explaining it always makes me look just a little crazy. Maybe some of you that are familiar with energy work and that sort of thing, muscle testing is a part of what we do to get information. The first step, though, is we evaluate the autonomic or involuntary nervous system for proper regulation. So you've got two parts to your nervous system. One is voluntary. I'm going to reach over and pick up this thing, and my brain and my muscles and my nerves cooperate so I can do an activity like that. The other side is the involuntary nervous system, which runs heart rate, breath rate, digestion. I think I have those up here. I always do the talk and then catch the slides up. Heart rate, blood pressure, digestion, sleep cycles, mood, weight management. These are all things that are handled by that involuntary nervous system. So we want to look to see, is it operating properly first? The way that we do that, there's it's called a heart rate variability test. It's a heart rate monitor that goes on your body. It's hooked up to a software that we're running. You lie down. It gives us a graph of what your fight or flight versus your resting, healing nervous system is doing. Your sympathetic is fight or flight. Parasympathetic is the healing and regulating side. So when you're lying down, I'm looking for a particular pattern that shows me fight or flight is at rest. Your regulation of your body is active. When there's a certain point in the test where you stand up, and I should see an appropriate reaction to standing. Fight or flight should go up to meet the stress of standing, which always pushes parasympathetic regulation down. So without weighing you down with the details, essentially we're looking for, did your nervous system give the correct reaction to a stimulus? You eat food, your brain is stimulated to tell your stomach, make gastric acid. If your nervous system isn't operating properly, you might get the message, stop making gastric acid, or just no message at all. So, and this is actually, I'm glad I brought this as an example. All of the GERD, gastroesophageal reflux disease, which used to just be heartburn, and you could do a little baking soda and it would be over, but now it's a disease because there's a med for it. Careful, Suzanne. Are there any medical doctors in the office? I actually love when there are, because they're cool people. So if you are not digesting your food, it will sit there and putrefy a little bit and create acid that comes up and causes this backup of acid. So it's typically not that your own stomach has lost its way and is making too much acid. If you're stressed out, it will stop your stomach or reduce it from making gastric acid. Your body thinks, stress, you're running from a bear, and it's time to run. We're not going to digest right now. We're going to shunt blood away from the digestive system and toward the large muscles and raise the blood pressure and the heart rate so we can run. No digesting for now. So if you are constantly under stress, you are going to have a dampened ability to digest your food. And the medical world will give you something that blocks your acid, which is kind of wrong direction, because now you're passing really undigested food into the bowel, and whenever I have an irritable bowel case or a Crohn's or celiac case in my office, they almost always have a history of having been on those long term, a year or two. Too long, it's not meant to be. If you read the insert, it even says you're not supposed to do that. So what we end up doing in our office, if it muscle tests to be true for you, is put you on gastric acid supplements until we get figured out why your stomach's doing that. And you should be able to figure that out and get that handled and get off our supplements that we're helping you digest. You should be able to do that without a supplement. So, how's the info going? If you have questions, please don't be afraid to stop me. Go ahead.
So when you get a Crohn's patient or an irritable bowel patient and you put them on a gastric acid supplement, you're also addressing all that other sympathetic nervous system issues, right? Like their stress relief or their mood, their depression, whatever might be affecting their gut.
Absolutely. Absolutely, because your point is spot on. I don't want people to be on a bunch of supplements to be well either. So if you're not going after the underlying issues that have them in this state, you're not fixing anything. So you're just going to keep taking the supplement. Is that kind of what you're saying?
Yeah, or I was just asking, I was sure that there must have been more to your approach than to just giving them.
Absolutely. Yeah, for a Crohn's case, and again, what I love about the muscle testing is there is no protocol to respond to the name of a disease. What happens, and we'll get into it in a second, is each person is assessed a layer at a time. Sometimes they're there for Crohn's, and the muscle testing leads me to their spleen first because of a mercury toxicity. And it won't even let me go after anything bowel-related. So we're working on that in certain cases, depending on the severity and length of time and the patient's compliance for sticking with what we're seeing. You fix the mercury toxicity, and now absorption and inflammation start to improve. Inflammation drops and absorption comes up, and the gut starts to heal without me having to do anything. Of course, diet is imperative. You aren't going to get results if you're not eating food. You have to eat real food. So, does that answer that? Okay. Yeah, and we do. People get to a point where they're getting great results with the diet changes, and some are faster than others. And then we have a person who stalls out and can't get anywhere because they're so stressed out. They're overbooked. They hate their job. Everything's a mess. And I'm well networked with people in the community that work with that stuff. That's not my forte. But if you're not going to address that, we are going to be spinning our wheels. So you have to go after that too. So I'm always looking for mental health counselors and people who do that, who don't just put people on drugs, because then there's that. So blood sugar imbalances, skin problems, weight gain, bowel dysfunction, hormone imbalances, chronic pain. You could list them. For if that nervous system regulation is off, you start to have a buildup of these issues. Step 2 is you evaluate the organ systems for weakness using muscle testing and acupuncture alarm points. So not everyone has been around muscle testing, so I'll do a quick little try to explain it. Essentially, when you're using muscle testing, what you're doing is you're using muscle strength to be able to capture a nervous system change. So for example, if you have we could use any muscle, the arm is easy. If I put a pressure on the arm and you can stay strong, if I stress your body in some way, I wouldn't do this, but if we pinched you firmly, you'd have a fight or flight reaction. Your pupils would dilate, heart might flutter, sweat glands might open. Those are all fight or flight reactions. Another fight or flight reaction to a stimulus like that is that for about 10 to 15 seconds, voluntary muscle control is slightly inhibited. Not fully, or we'd all be dropping like amoebas, stressed out, walking around. Oh my God! Not the gross muscles, just the small ones. So if you have a strong arm and we irritate you in some way, for about 10 to 15 seconds, the arm will go weak. It's a long lever, and I'm testing a very small muscle, so it's easy to pick up the change. If we were going bicep, we'd be there all day, not being able to tell if that was strong or weak because it's subtle. So there's a certain way to go after it that lets you get accurate information from the body. So your nervous system is informing us if something irritates you or pleases you. So strong arm, if I touch over acupuncture points, that are connected to organs. There's an alarm point that is correlated to an organ. The pituitary gland happens to be here, strong arm, here's the hypothalamus. When Nora was talking about that HP axis stuff, it's all right up in here. Sinus, tonsils, thyroid. When you touch an acupuncture point of an organ that is under stress, it will irritate the nervous system and your arm will go weak. It's that simple. So you can uncover organs that are under stress. You may have no symptom about that organ, but we will see, or your body is leading us to what's most in its attention. So you come in for thyroid stuff, and your body's pointing me to your gallbladder. I'm going to follow your body, because if we go in the direction and handle the layers that your body hands up to us, you may heal the thyroid yourself. Or there's a part along the process that your body does point us to the thyroid. Now that I'm digesting fats and absorbing those better, I would like to talk about my thyroid. So the body gets to run what we're doing. Does that make sense? Anybody want to, skepticism is super intelligent and necessary, so you won't offend me if you have questions about the muscle testing. I don't think I have the kits, huh? I don't need them. I'll just talk about them, and then here's the next step. Go right ahead. Who said that? Oh, hello.
I'm a believer in it, but what I would really like to know is, have you ever done any kind of empirical work where you test somebody one day to find out what they test week 4, things like that, and then do it another day without doing anything else?
Yes.
Just to replicate your findings. I'm just curious as to,
You know, it will be fairly consistent, but it does move around. Part of the reason I believe that is, and it's hard to get empirical data, and that is part of why this work kind of gets like, especially, we have medical docs who refer to us and stuff because of our clinical results, you know, but when people hear it for the first time, especially if they're docs who want to see what you're asking for, you may show one day that you are sensitive. I pick up, let's say, acetates in your system. You could have walked through Lowe's 2 days ago, and I am going to pick it up with this system, but your own body's going to flush it out, and it won't be there next time I see you. If it is there next time, we're going to evaluate at what level severity is this, and it could be something that's you've been carrying around because of a story that you have that makes that make sense. But it is hard to get, you know, practitioner. Alicia Feltis is an associate in our office, and she does muscle testing on the patients and takes great care of them, and so do I, and sometimes we treat each other's people. We can have variances in how we get to the information, but in general, it stays very solidly on the main subject, and the person keeps responding.
I guess I'm also wondering, like, if you have a really bad day.
Yes.
Something happens, I don't know, if your dog gets hit by a car.
Yeah.
Will that change the result from one day to the next as to what is most important?
It could. It could, and we would be aware that, like, let's say, for example, someone came in yesterday, and we've been working on handling a fungal and parasitic imbalance for them and detoxing lead. And nothing showed. I'm sure that stuff's not gone yet, because my clinical knowledge knows you don't go from having it up here to gone in a few days. But she got a really hot virus, got a cold, and it sort of masked the other stuff, and we had to deal with that before the body would let us get back to that. But her body tested for going ahead and keeping the supplements that went in her program to handle what she was doing before. Sometimes it doesn't. Sometimes everybody's like, everything off, I don't want to do any of that while I'm handling this virus. So everybody's different, and that's why I feel totally spoiled to have the muscle testing to be giving me the info to act on. And I'm sure it's not perfect. I'm absolutely clear about that. But the rate of results that we get with it is, I just love my job. It's so much fun to see people get control and understanding what's going on in their systems, and then nudge, nudge, tell other people, you know, because I see so many crazy things come in my office that I am floored every week that so many people don't know. That chlorine in your tap water will suppress your thyroid. So many people don't know that. Just get a Brita filter. You know, maybe someone else needs more filtration than that, but just as a simple start. Maybe, yeah, I could go on those things, but I won't. Okay, so once you figure out the organ reflexes, you want to know why are they testing weak. Metal toxicity is a reason. We have these homeopathic test kits, and again, they're over at our table. They're tinctures that contain the substances that we're testing for. Homeopathy is kind of a crazy subject. It's mirror speak and it's energy medicine. The general way to explain it is each vial containing something specific, wheat, corn, lead, acetates, has its own energetic wavelength that is a part of its composition. So everything is made up of atoms, right? And each atom has a negative and a positive pole. They're spinning. If you know anything about electricity, when you get a negative and positive pole spinning, it will emanate an electrical current. So things put off bioelectrical energies. Not everybody's down with that. So those people will show up when they've tried everything else and they don't care that they don't believe it anymore. They just are willing to try anything. And they're actually my favorite because when you feel the muscle testing, you kind of get a little bit of a relationship with it that kind of helps bring it in for you. So anyway, we're checking for metal toxicity. We pick up a lot of aluminum. It's in over-the-counter meds, prescription meds. It's in antiperspirant. It's in Tums. So we pick up a lot of mercury. It's in old dental fillings. It's in vaccinations, fish. We still tell people eat fish. If you get healthy and all the other areas of your health are rolling, you can detox mercury from fish. You wouldn't want to be eating it every day, but fish is a great source of protein and the omega fats and that sort of thing. Chemical toxicity, we pick up a lot of chlorine, plastics, food preservatives. Formaldehyde is actually, anybody who's doing diet sugar-free stuff, that is aspartame or NutraSweet related. Aspartame, phenylalanine, is almost molecularly exactly the same as formaldehyde. So we pick it up in our testing as formaldehyde. So crystallite is not your friend. You might get all skinny and everything for a minute, but so formaldehyde is also in SPF formulas that are in your sunscreens. So anybody who's using SPF formula face lotions and makeups and body creams, Planned Parenthood had a big conference probably 8-10 years ago that was all about how the beauty products that we put on our bodies and the shampoos and the soaps and our cleaning products and all those things are having a huge impact on reproductive health. So we teach you about that and plug you into all the resources for knowing where that stuff's coming. Lead, by the way, is in mascara and lipstick. So you're eating lead off your lips if you're wearing that stuff. We test for the main stuff first: grains, sugars, dairy, and eggs. And we have kits that get more specific. The neat thing is, anything you're wondering about, you can actually bring the food in and we can check it. If your body comes up not liking dairy, the question usually goes to, well, can I do goat's milk? I don't know. Bring it in. We'll test it. You can muscle test the foods directly and the elimination diets are very powerful and very confusing and annoying and hard to stay with. The muscle testing will help you understand, we're saying stay away from root vegetables right now. You're fighting a yeast issue and it breaks down and it feeds sugar, it feeds the fungus. Sugar feeds fungus. Well, can I have sweet potato? I don't know. And boy, when people test okay for a food, it's like the light goes on. Woo! And then they can go the other way too. I get a little bit of hate mail. You took my wheat.
Just a better understanding, say if you wanted to test if you were allergic to a food.
Yes.
How would you do that based on the muscle?
Well, again, if in a very general sense, there are times, if there's no other confusion going on in the body, if you have a strong arm and I put a food in your hand that irritates your nervous system, you'll go weak. I know. It's kind of wacky. I have one guy who keeps bringing his scotch in. You can leave that with me. So food sensitivities, by the way, we have a lot of people come in who have a few food sensitivities, and then next thing you know, their list just keeps growing and growing and growing. That person typically has underlying issues of metal or chemical toxins or fungal or parasitic imbalance, gut flora imbalances. You're already inflamed, so you can't handle foods that tend to inflame. So if you handle those underpinnings and get inflammation under control, a lot of those foods that are showing up as allergies, even on the blood labs and the RAS tests where you get picked on the back, can change. Some of them won't. Your body just doesn't like them, and you need to keep them in minimal amounts. But when you've got a list that's huge, that's a sign something's not right, and it doesn't have to be a scary disease thing. It's just you've got some work to do to clear the issues that are keeping you inflamed and irritated easily. So immune challenges, we check for fungus, yeasts, parasites, bacterias, viruses. I have other kits that can detect other pathogens that it's not legal for me to diagnose and treat disease, so I'm careful with my words. But we can pick up on pathogens if they are at a level that is irritating you. We'll see it because your nervous system will be irritated. We all have fungus and parasites and bacteria and viruses. It's healthy and normal if they're in the right ratios. I will not see that in the muscle testing because it's not being experienced as a stress. So if we pick it up, it means something's off, and we would have to figure out what's going on there. So scar tissue is also something. It's kind of a difficult thing to explain, but we have handouts and websites to point you to. But the short story, scar tissue, especially scars that come from things that cross multiple layers of skin, surgeries, injuries that needed stitches, piercings, tattoos, they have an interfering effect on that involuntary nervous system. They tug and they create an interference in the brain and nervous system talking to the body, and the body communicating back to the central nervous system. So we want to soften the scars, get them to stop being in the way of that regulatory process that is trying to run your healing. So, yeah.
Can you do that without surgery?
Yes. Yes. It's a really complicated program, typically of wheat germ oil or sesame seed oil or coconut oil. You can do, some people cold lasering. But yeah, there's no... Someone else have a question? Who's talking to me?
What was the question?
Oh, I'm sorry, thank you. The question was, if you're handling scars, do you have to do it in a surgical way? Which can be complicating, right? Because it creates another scar. Sometimes you do need a surgical intervention if a scar is really being aggressive like that. But okay. Is everybody doing okay? Okay. So you design the clinically individualized nutritional healing program once you get that information. So let's say strong arm, we go over the liver reflex and the arm goes weak. We take the homeopathic test kit and we put it on your body. The energy does pass through the glass. It's radiant energy like the sun. If the kit on your body causes the weak liver to change to strong, something in the kit is part of what's irritating the liver. So you go vial by vial and figure out what that was. If it's lead, we have 10 or 15 different ways we would help someone get the lead out of their system. So the poison, which is the lead vial, will change the weak test to strong. So will the antidote. So if I put bentonite clay on your body, it's very good at soaking up lead. Put it on the body and the liver stays weak, it's not going to help you. So it's a great product, but you're not going to get the results we're after. Test cilantro, chlorella, herbs in your water, homeopathic remedies. The one that strengthens that weak reflex is the one that works for you. And then it gets dosed specific to you. 3 weeks into the plan, your body might change its mind and say, I don't like that anymore. It's not working, it's constipating me. So sticking with the person and monitoring the process lets us stay very specific and pristine to catching when the body shifts. And I think that's why the results are strong, because if you do something and say, well, why don't you come back in a couple months, let's see how that goes. And if you end up getting a rash and bowel symptoms, I may never see you again. You're out telling people that we gave you a rash and some bowel trouble. So we stay close and help you get through that part. Any questions about that part? It's really cool to feel it. Hearing it is one thing. Watching somebody do it is another thing, but actually having it done, you'll feel it. It's really obvious. Strong versus weak is, it's probably one of the most fun parts of our job, because people are like, oh my God. You know, even like buff, really working out hard people are like, try that again. And they're like, recreating muscles from the soles of their feet. So muscle tests for which whole food or herbal or homeopathic supplements are needed to begin clearing the barriers to healing. Work with the food sensitivities using a food journal and making gradient changes toward the diet that promotes healing. It's not a diet. It doesn't happen overnight for most people. I mean, if you're third stage lung cancer, gloves are off. We are getting very aggressive. You are going to drop sugar right now and things like that. But for the person who's dealing with more, functional long-term stuff, we look at the food journal and we see, based on what the muscle testing said was going on, so we're not going to coach you about a type of diet, because there's a lot of great diets. Eat in the zone, eat for your blood type, Atkins, paleo. They all have truth in them. But which one is right for you is kind of what you want to figure out. So let's say you showed up with a fungal imbalance and your body doesn't like dairy and it doesn't like sugar. We're going to look through your journal and see which one shows up to be the larger culprit for you. If they're all kind of equal, let's circle them all then. And if there's 50 things in a week that hit the category of pull you down, how about next week we'll ask you to drop that to 35-ish. And we're going to give you recipes because we see what you like. Now we can turn you on to some things that could be things to try, and recipes and websites and meal planning classes and all that stuff to support you to shift your food in a way that will be a lifestyle change, not a quick diet. That there is that rebellion sometimes in the first few weeks or months of, when can I get back to eating like I was eating? And the guy who taught me this stuff, Dr. Lester Bryman, he's in his 80s, said, you tell your patients as soon as they want to get back to feeling like crap. Although he didn't say crap. He's like an ex-Green Beret. He's really cheeky. But he's serious. And my practice, we don't really run it as harsh as he does. He was on a mission to take down the pharmaceutical industry. He's upset about the number of children that are being drugged and the elders that are way over-medicated and not being fed real food. It's a heartbreak. And so he didn't care if you were in his office and it came up, no sugar, no wheat, no dairy. If you didn't drop it, you weren't doing his program. You call me when you're ready to be serious. We don't do that because I can't really live that way. So I think I attract people to our practice that need a gradient road so they can get there. So food sensitivities. How am I doing on time? Oh, I got 10 minutes. In summary, it's like you heard me coming. So hey, in summary, fabulous. It's like we knew that was coming. So food truly is the only source that contains the genuine replacement parts your body needs to heal and maintain itself. Remove the stressors that block the body's ability to absorb the nutrition. Temporarily use whole food supplements, herbs, homeopathic remedies to help the body clear the stressors. Temporarily, people come in with bags of stuff because you're trying to figure it out. There's Dr. Oz saying cool stuff. There's Good Morning America saying cool stuff, and whatever you're reading and online, and all of it's smart stuff. But you could actually create some pretty big confusion in your body taking all of that without knowing if it's actually correct for you. So we do some testing in that way too. Things that people are currently taking get tested in a few visits to see, do they really need it? And if they do, are they taking the right amount? I just had to put this in there. Love, right? Food, yes. Shelter, yes. Love, yes. So I appreciate your listening. I would love to talk to you. We're here at the table today and tomorrow. I wouldn't be doing all of my training justice if I didn't tell you that come over, check out our station. We're offering discounted visits for people to come do an initial screening with us so you can get information. I do not care if you come in and become a patient and sign on. You might learn something really simple, like chlorine is irritating something, and you can get a Brita filter and aluminum showed up and you should change your deodorant, your antiperspirant. So thank you for listening.